Welcome to What to Expect at Your Child's Dental Cleaning. A child in the dental world is considered a child until age 13. Then at age 14, they are considered an adult teeth cleaning. This video is intended to show an overview on what is really happening during a kid's dental appointment. Hi, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, let's watch a pediatric child teeth cleaning appointment at the dentist. And before we get started, I want to give a quick shout out to the Teeth Talk Patreon and the YouTube members who support this channel. I love that you are part of this mission with me on spreading evidence-based dental health information. And having said that, let's talk. First, we'll call the patient back. We'll check with the parent or guardian and ask if there's any changes in the patient's health and or if there are any dental concerns. Once the child is seated, we ask how school is or how their summer's going. We try to make them feel comfortable and talk about something new and exciting that may be going on in their life. Then we will check and see if the patient needs any x-rays today. If the patient is due for x-rays, we start by placing a lead shield with the rest of color on them. I personally like to try and make x-rays fun, and I like to joke with the kids that I'm taking photos of their teeth with the funniest looking camera ever. That's my go-to joke and it usually works. We use a small sensor for kids. As you can see, the difference between the big size 2 adult sensor and the small size 1 child sensor. It's much smaller and more comfortable fitting for a small mouth. Generally, the first time we take checkup x-rays, bite wing x-rays, is around age 5 or when the first adult molars erupt. My patient in this video is 11 years old and today she is due for bite wing x-rays. Bite wing x-rays are indicated routinely, usually around once a year, but each patient has a different x-ray frequency that is evaluated based on an individual basis. And each case and Carrie's risk situation is different. Again, here I am trying to make jokes, because kids have small little mouths and sometimes it's hard to bite down. Even if you're an adult, x-rays can be a little difficult, so comedy is my go-to in every situation. I try to make it fun. I like everyone to have fun and I like everyone to smile because that's what teeth are all about, smiling. So next, we're laying the patient back in our roller coaster chair and we count the teeth and we mark which teeth are existing on the chart. Like I said, my patient here is 11 years old and she is in the heart of the mixed dentition stage. Lots of adult teeth and lots of baby teeth and lots of missing teeth. Another question I like to ask kids is if they have noticed any current wiggly teeth. It's always fun to hear their stories of how they've lost teeth and how they get prizes at school for losing teeth. It's fun to hear all the stories they have. So now, to count the teeth, we use a mirror and an instrument called an explorer, aka the tooth counter. And once everything is in the chart, we start cleaning the teeth. But we have to make sure everything is marked existing or missing in the chart so we know what kind of teeth we're working with. There's a lot of baby teeth, there's a lot of adult teeth, there's a lot of missing teeth at this stage in life. Next, now, each office may be different. I know some offices prefer to polish first and then scale, but I personally usually scale first and then polish. Depending on the age and plaque and tartar buildup levels, we may scale with hand instruments, but if the child is very young, 3 or 4 years old, or no plaque is observed, sometimes I'll only use the explorer, aka the tooth counter. And sometimes this step is not required at all. So it's really a case-by-case situation, but if we are scaling with hand instruments, generally we will use the mirror again, and we will occasionally wipe the plaque off the instrument onto a gauze pad. So we will scale, and make the teeth super smooth, free of any plaque bugs. Oftentimes the light is way too bright and gets in everyone's eyes. So if the office doesn't provide sunglasses, feel free to bring your own and wear them so you won't have the bright sunshine in your eyes. And now you have a nice, comfortable cleaning. You get to sit back or lay back and relax like you're at the dental spa. So after scaling all the surfaces of all the teeth, may I note how nice these camera shots are. Ooh, right? So now it's time for Mr. Thirsty, our suction. He drinks up all the water we use to rinse off the plaque bugs. So Mr. Thirsty's oftentimes a hit. Sometimes he's a little loud, but most kids love him. He's thirsty and he's funny. So watch him here drinking away the water. Oh. This one's really cool because you can actually, it's kind of clear, so you can see the water suctioning through Mr. Thirsty. Sometimes you can't see inside of the straw, but here you can see. Now we're just finishing up. We did all the front teeth, the anteriors. Now we're going to scale all the back teeth, the posteriors, and after everything is scaled and rinsed and clean, we will polish. Here, I'm asking my patient which flavor of polish she would like. Currently, our choices are cotton candy or blue raspberry or mint, and she chose blue raspberry. You can see the fabulous blue raspberry here. We're using a Profi angle, aka Mr. Superhero toothbrush, and he spins and cleans your teeth like a superhero would. He dips into the blue raspberry and then he superhero-ly cleans your teeth. Look at that blue. Sometimes I like to joke that they're Smurf's teeth, or did you just kiss a Smurf? Mr. Thirsty is drinking up the blue now. He wanted to taste up the blue, and that's just how it goes. We're rinsing and then we're polishing and then we're rinsing and then we're polishing, and we just keep repeating that until all of the teeth are clean, polished, and then at the end we do a really great rinse. We rinse everything away and then we floss. After we floss, I like to use the air, which is the same water instrument, but it's on the other little button. We like to blow the air on the teeth, and that confirms that we didn't miss any spots. So there's no plaque bugs hanging out when you blow the air on the teeth. It dries the tooth so you can clearly see if there's any residual plaque bugs left over. It's kind of like our double check. And then if there's anything, we'll go back in and remove it. We'll also do an oral cancer screening. We check the sides of the tongue, we check the roof of the mouth, the back of the mouth, all around the mouth, under the tongue, making sure everything looks healthy. And then we might go over some oral hygiene instructions, home care tips, while we're waiting for the dentist to come in and do the exam. We also try to go over all the stuff we're giving you in your goodie bag so you know how to use it when you're at home. Then once the dentist comes in, the dentist will say hi, chat a little, see how they're doing, same thing, same greeting that the hygienist did. And then the dentist will specifically check for any cavities and if there's anything concerning in the mouth. For super young little kids, the real little ones, it's easy to explain to them that the dentist is going to recount their teeth and make sure that we counted right, you know, things like that. So next, after the dentist does the exam, we will do the fluoride treatment. There are two types of fluoride in most offices. You can usually pick, or maybe they only have one or the other, or maybe they recommend one over the other for you. Right here, you can see us demonstrating a fluoride foam treatment. The foam fluoride is placed in these trays, which are placed in the mouth, and it usually takes between 1 and 4 minutes. After it's removed, you have to wait 30 minutes to eat or drink anything. The good thing is that your teeth will feel nice and smooth. Here we are demonstrating a fluoride varnish treatment. I usually recommend this one because it has a little more fluoride concentration in it, and the benefits may last a little longer. Plus, there is no gagging to worry about because we are just painting the teeth. It's super simple, and you don't have to deal with that large foam piece in your mouth. The other good thing about the varnish is that you can eat and drink right away. We just ask you don't eat anything too sticky for the next 6 hours and nothing too hot. The one thing about this one that some people don't like is that the teeth may still feel a little sticky for a little bit. I personally think it's worth it. A little more fluoride, a lot more cavity protection benefits. Again, for the younger kids, I explain it as the vitamins for your teeth. So now we're done. You did it. You have beautiful clean teeth. Lastly, it's treasure test time. Time for the prize box to pick out a fun little toy. It's a great positive reinforcement that shows how proud we are of you and how awesome you kept your mouth open and sat still in the chair the whole time. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And thank you again to the YouTube members here and the Patreon members supporting this channel and supporting dental health awareness. If you want to join the fight in making sure evidence-based dental health information is being shared online, become part of our Teeth Talk community. The links are in the description box below. And until then, I'll see you on Instagram @TeethTalkGirl. Peace, love, and teeth.